Great. Hello, everyone, and welcome to this session of the AI Nurses Network webinar series. Today, we've got a great nurse with us, Professor Gregory Alexander, based at Columbia University in the USA, who's going to talk to us about HIT maturity when AI is involved. Over to you.
Oh, thank you so much for having me today. And I'm going to talk a lot about the long-term care space today, long-term post-acute care, which most of my research has been in nursing homes, assisted living, independent living facilities, home health care. So those areas are sort of target areas where I look at hip maturity, and I'll define that as we go forward. And most of the presentation today will focus on community settings, primarily nursing home work. So these are sort of some objectives. I'll give you a little bit of understanding about hip maturity measurement and best practices and use of technology, and how we're measuring that, and then highlight the role of hip maturity. So as far as understanding my sort of background and model that I utilize to sort of frame my work, I utilize most recently value-based care framework, which is a very important sort of policy and legislative initiative in the United States, where payments tied to the value of care that's provided. So trying to prevent rehospitalizations, avoid emergency department visits, trying to keep people in their home and trying to put services around them in the community where they live, and to prevent them from going to the hospital when it's not necessarily needed. And so value-based care is a new model, essentially, that basically emphasizes the role of digital maturity and in relationship to how interoperable systems are, how they exchange data, how it's used, and how it's exchanged, which is very important in long-term care because most of the time, long-term care organizations in the community don't have the resources that hospitals and acute care settings, ambulatory settings have. They don't have labs, they don't have pharmacies, so the exchange of data with them in these areas is very important. And then how they transform their care delivery in relationship to the technology that's being delivered or implemented in their facilities are very important. And then, of course, with AI, risk identification and engagement is really important. We did a scoping review just to give you a sense of the importance of hip maturity and emerging models of care that use technology with AI. We got a group of us who were part of the American Association of Nurses, American Academy of Nurses, excuse me, did the scoping review where we looked at over 3,000 records and from 2018 to 2023 to look at different models of care that are emerging that use technology in the care of people in the community. And we ended up having over 100 articles that were analyzed that were part of our inclusion criteria. And you can see here the percentage of those articles and the types of care models that were being implemented. And if you notice, you'll see predictive analytics, machine learning algorithms, those types of AI kinds of models in community and long-term care settings are near the bottom, around 11% of the research that we saw within the past 5 years or so were pretty low on the scope of using AI in long-term care. And I think that reflects the fact that there aren't really strong IT departments in long-term care settings. There's people in long-term care settings are not really trained to utilize technology effectively and efficiently, so that influences implementation and perceptions of how it's used. But there are some evidence that it is gaining strength in certain models, such as remote patient monitoring, such as sensing, and where patients and caregivers are living in the community, or wrapping technology around them to understand their progress as they're healing when they come home, maybe from a hospital, or if they have a chronic condition that needs ongoing management. Of course, there's always education engagement as part of the hip maturity, especially in long-term care, because they also don't typically have education departments. So accessing online training activities is really important, and the outcomes associated with those. So and you can see other sort of models here that are really important. Then as you look at the technology that's being utilized within these long-term care settings, there's a lot of data entropy. In other words, data exchange is very important. There's a lot of movement in the types of data and types of technology that are supporting the use of data in long-term care. So for example, wearables and mobile apps are tops on the list as far as being able to keep people at home in their setting. And these devices really oftentimes, especially with wearables, may collect data 24/7. So AI is really needed to be able to analyze that amount of data and to inform nurses about and other healthcare providers about certain chronic conditions that people have, and the wearables are being used to monitor. You also see the remote patient monitoring is another area, and AI and machine learning algorithms were in about 20% of these studies, and I said there was over 100 of them. So, about a fifth of the studies that we've seen have certain AI and machine learning algorithms associated with the research that's there. I believe that's growing. It's not been something that has been evident in the past, but in the last few years, with the advent of better AI tools and the spread of AI tools across healthcare, these things are becoming more important. You'll also see robotics down there. That robotics is on the lower end of the scale, but as far as what we see in research, but I believe that is also a growing area where robotics can interact with people. Robots can interact with people that are trying to stay in the community, and then share that data back to providers that maybe make decisions about them remotely and their care delivery. Virtual reality and augmented reality are also areas, of interest, especially in AI, and trying to understand how that influences perceptions and of people's care delivery and their ability to stay at home. So the current contexts are really important for understanding why certain types of AI applications are not really being adopted as quickly as they are maybe in other settings like acute and ambulatory care. And that's because long-term care, post-acute care settings oftentimes operated with limited resources, like I said, and limited HIT expertise, health information technology expertise. There are other barriers, like especially in the United States, we have a real lack of broadband in rural areas. So rural facilities are really at a disadvantage for adopting certain types of technology. They may use AI to help them build better systems of care for their residents. And then training and support staff are also areas that are somewhat barriers for new innovations in technology. We also know that because technology, the infrastructure is somewhat lacking in long-term post-acute care, that there is a certain amount of turnover in certain technologies. And we've understand over time that when we compare trends in technology, that there's about just over 25%, or a quarter of the facilities that implement technology will oftentimes abandon it because it's not working as it should. People don't understand how to utilize it. The infrastructure is not good enough to support it. And so you can imagine what kind of turmoil that might cause by implementing certain types of technology that help with decision making, and then to abandon it because it doesn't work and going back to a lower level of interaction with paper or fax or other types of technologies that are very rudimentary. But about almost 45% of the homes have growth in nursing homes. So there are some trends, and I'll show you a graph of that in just a second and show you what I mean a little bit more by that. But we do know that hip maturity and these things are really important because they do impact patient outcomes. However, hip maturity, including AI implementation, is not part of quality reporting mechanisms that are publicly available. So we really don't know what the trends are without this kind of research to help us understand what's going on in this sector. We sort of look at hip maturity over time as an important area of performance. So when you have new innovations like AI, your performance may not be as good as it would be after it's been implemented over several years. So EHRs, for example, in acute and ambulatory care are very strong, very mature in the United States with our legislation that was passed in 2009, 2010 that really incentivized the adoption of technology in those areas. Systems became very mature very quickly. So AI systems are pretty robust in those settings, but in long-term care, who were left out of those incentives programs in the United States, we are still at the stage of really implementing new technologies that might be used in other settings more robustly than they are in long-term care. So we don't really know yet what the true impact of those are, but we do know that they do make an impact on quality in some studies, and quality of care is improved over time. This model is an important model. It's one that I utilize to help sort of understand hip maturity in long-term care. There are healthcare domains, 3 healthcare domains, including resident care and technology that supports different types of resident care, clinical support, which is lab, pharmacy, and radiology, and administrative activities that help support the infrastructure and implementation of those technologies in resident care and clinical support. And then we look at the different capabilities that are in long-term care, and those are important because it defines what a nursing home might be, for example, might be able to implement. However, they may not implement everything, so the extent of use of the digital maturity and technology that they have implemented is very important, and the degree of integration so that they can share data to meet the value-based care goals and enhance their recuperation of certain financial resources that help them build stronger systems is important. So we measure these areas, and the 3x3 matrix forms a nine-dimensional model that we can utilize to really hone in on areas of importance. One of the ways that we develop this model is we utilize Delphi methodologies. Delphi panels are really important, where you have experts that understand different types of technology in long-term care. We've updated our surveys 2 times in 2017 and 2022, and we have had, in the last go round of updates, we had 22 long-term post-acute care health information technology experts that reviewed all the content areas of the hip maturity survey from different coalitions and collaboratives that are interested in promoting technology use. And we reached levels of consensus across these experts that were important for agreement on what the technology model should look like. And then we reduced the content of the survey and refined it for relevance, including use of AI resources, because those were fairly new in the last few years compared to 2017. This is sort of the model that we have for hip maturity with staging. Staging is very important because it allows us to utilize the hip maturity survey as a way to compare facilities. So if you look on the left side of this model, stage 0 to stage 3 ranges from non-existent HIT or EHR implementation. In other words, there is no HIT or electronic health records in place in the nursing homes that are at stage 0. There are some of those that are present. There are not as many as there used to be, thank goodness, but we're moving in the right direction. And it goes all the way up to stage 3, which is basically automated internal connectivity. So these facilities that are stage 3 or lower are able to exchange data internally, share data with people within their facilities, but they're not really good at sharing data externally for which is important for interoperability. And when you have AI systems that are utilizing data across systems to share information about patients that move in and out of facilities, stage 3 and lower, you may be missing information that could inform the AI systems. So that's it's very important to understand what their capabilities are and how they're utilizing it. And then stage 4 and above is automated external connectivity, the predictive analytics that I sort of mentioned in the scoping review, where we had a pretty high percentage of facilities or research that shows that predictive analytics is an important area in an emerging model in technology and long-term care. And then stage 6 is the highest level, where you have resident-driven clinical data that's collected either by wearables or other types of embedded technologies in the environment in the community that can inform the care delivery decisions about those people who are living remotely, to keep them out of the hospital and to help them manage their chronic illnesses better. So these stages sort of help us identify trends, and they help us to identify what higher stages, how that influences quality of care. We have essentially in the model, we have 21 content areas in our revised model as of 2022, and I'll show you those in a minute. We did reduce our content areas from, we originally, prior to that in 2017, had 27 areas, but as a result of the different types of technologies that were outdated and maybe not as important to be measured in long-term care, we were able to reduce some of those areas, which decreases the burden in completing the survey, because it is a fairly lengthy, comprehensive survey. Original survey in 2017 was 183 items, and currently it's now at about 142 items that help us understand digital maturity in these facilities. There were 13 new content items that were added in the last Delphi round, and we actually had 4 domains of care, including resident care, nursing care, clinical support, and administration. So nursing care, the experts felt it was important to pull out how nurses were using technology, specifically in long-term care, because most of the staff in long-term care settings are nurses. They're the ones who are leading and managing care delivery in the facilities with the support of a provider, a higher level provider like an APRN or a nurse practitioner or a physician. This is the content areas in the current digital maturity model. So along the left side here, you see the content areas for resident management, nursing care, clinical support, and administrative activities. And within each of these content areas, there are specific areas that we measure technologies, such as technologies that are used in resident management processes, which are computerized, or documents in resident care that are computerized. And you'll see that there are a certain number of items within each of those different content areas that are demarcated. So the resident management processes that are computerized has 7 items in the survey that measure that area. And you can see how they're broken apart according to the stage that they're in. And you'll see there's very few of these that are at stage 1, 0, or 1, because there's no technology in those facilities, versus all the way up to stage 6. So we can get a pretty good idea of how people are trending and utilizing technologies within each of these content areas over time. And we've done that. I have basically over the last 10 years done studies in long-term care skilled nursing facilities from 2014 to 2022, and we currently have our another study that's ongoing that's in its fourth year, where we've also measured hip maturity in long-term care settings. So what you'll see here is all of the 9 dimensions: resident care, clinical support, and administrative activities, and within each of those, the capabilities, extended use, and integration that is measured in the surveys that we've done. We've done essentially tracked over 2,000 facilities over time, not necessarily every year, but at least once, if not 2 or 3 times. And we've had about 20% of our facilities at least complete surveys every year. So we have a pretty good sample of facilities that we know what has happened every year since we started doing the surveys. And what you can see is in each of the dimensions and domains, there is an increase in digital maturity over time. You'll notice on the left-hand y-axis that the total scores go up to 80. Actually, the scores are weighted, and when we have them, they actually go up to 100. So you'll see that most of the areas do not have full capabilities. They don't use the capabilities as extensively as they could, and they're certainly not integrated as well as they could be. So there's still room for improvement, although there are gains in use of technology over time in these facilities. But there's a lot that goes on within these measures as technology is being implemented over time. For example, we understand that within these facilities that about 70% of them are stage 3 or below, versus facilities that are a higher level, stage 4 and above, which are around 30%. So in other words, about 30% of the homes in the surveys that we've been conducting have really good external connectivity and interoperability, whereas 70% of the facilities do not have really good external capability. They have strong internal capability, but it could be better in order to exchange data and to be able to use the systems most effectively. And you'll see that just about 2% of the homes are stage 0. So there's very few homes that are stage 0, meaning they have no technology at all, versus stage 6. You'll see about 3% of the facilities are really implementing technologies that are focused on resident care, or not resident care, but residents adding information to the electronic health record and being able to interact with that. So we have a lot of room and growth in that area that we can utilize to engage patients in their care delivery with use of technology. This is another example of sort of the trends in technology that we look at over time. And this specific study involved 306 nursing homes that had completed a survey in 1 year, and then 2 years later completed it again. And you'll see that these facilities within this sort of red line indicate that they had a total hip maturity that ranged anywhere from 0 to almost 300 in year 1 along the x-axis, and then on the y-axis you'll see that they had a total hip maturity of anywhere from 200 to 600. So in other words, they had growth in their digital maturity over time. These facilities, conversely, had pretty significant amount of technologies embedded in their systems early in our survey processes. So in year 1, they range from anywhere from 4 to almost 600. These facilities did, and if you look compare that to the year 3 along the y-axis, you'll see that they had dropped or abandoned technology, and their total scores were anywhere from 200 to 400. So there are there are areas where there needs to be attention drawn. Why are they abandoning technologies? Is the technology not good enough to implement? Or is it the infrastructure or training? There are a lot of issues related to this abandonment that we need to understand, because we know it does affect quality of care. So we pulled together a bunch of experts to help us understand emerging trends in technology adoption and use in the care of older adults in the community. And these are sort of 4 areas that they discussed in relationship to our digital maturity models and the importance of measurement. And they indicated that I think we had almost 50 people that participated in 2-day discussions at Columbia University in New York in June of 2024. And they talked about the importance of monitoring emerging models of care, such as AI, which was just becoming even more relevant at that time, and how emerging models of care are aligned with payment and value-based care and infrastructure to support new emerging models, and whether organizations are really ready. Workforce implications were really important as we think about digital maturity and how it's influencing care and delivering long-term post-acute care. So the capacity for them to implement technology, the capabilities they have implemented, how that impacts the workforce, and do they have the competency to be able to utilize technology such as AI and implement it in the care delivery system that they work in. Standards associated with different types of technology, such as AI, for example. There are really not good standards set for how AI should be implemented. Telehealth is another area that, with COVID, that really influenced technology adoption, and there were really no good standards in long-term care for use of telehealth that people could utilize during the COVID pandemic. And that was really important because people were isolated in the facilities in the community, and technology was the only way that we could get to connect them when they could not be seen or in a usual way. And there's also career paths for nurses or in other providers, and how technology, to be able to build capacity for the workforce to manage these systems, we have to train them and provide career pathways. So that's an opportunity for us. Transparency and accountability is another area, regulatory burden and data alignment. So the expectations of our policies, at least in the United States, need to be matched with what the capabilities of a facility in the community can provide, so they don't get penalized more often than facilities that are incentivized to implement technology. Trust and use of different types of technologies, especially with AI. And when you have no standards, or when you have a lack of standards, then you have some trust issues in how it's implemented and whether it's effective or not. And then consumer-facing transparency. So telling people how technology works and how it's being used to monitor them in the community when it's embedded, and it may not be relevant or readily apparent what kinds of data is being collected in a home where you have remote monitoring, and making sure that we're being transparent with consumers about what's being collected and how that data is being used is really important. And then finally, safety and privacy is very important. We want to avert risk, and technology can oftentimes induce risk, especially if you have issues of potential breaches of confidentiality and leakage of data outside of systems that you don't have good standards for, and how it's used in the community. So very important to think about that, and to think about consent procedures as you're thinking about the transparency of implementing technology and how it's used in environments in the community where patients are basically living with technology, and how it's what they understand about it. And that consent process can really help with that. Usability, of course, will help with technology abandonment, and there needs to be clear standards set for usability measurement and ongoing evaluation as innovations are implemented, and then shared infrastructures is an opportunity that I believe can be enhanced in across settings like hospitals and ambulatory care who have really good, strong infrastructure that can be utilized to reach out to communities that maybe have less infrastructure. So there's a way of sharing that infrastructure to support the systems of care that people use across settings. So in conclusion, I think we have an updated hip maturity model that will probably need to be updated again in another 5 years or so as we begin to innovate new technologies, build them into our systems of care, and that we provide a framework that helps us understand adoption, scalability, and sustainability of the technologies that are important to us as they emerge and become embedded in our care processes and workflows. And then it helps us to also guide facilities in their transformation processes so we can help them, informatics experts can help them build capacity by understanding where they are and what they need to do to move forward and gain hip maturity that's sustainable. And then potentially integration into national quality reporting systems so that these things become apparent as part of that transparency piece where we can understand where technology is in these settings, and so that people, when they're making decisions about where to live in the community, whether that be a nursing home or assisted living, that they know exactly what they're getting into when it comes to technology and monitoring and their quality of care. And I'll stop there, and I'll thank you very much for your participation today.
That's great. Thanks, Greg. There's loads of interesting work there done in care home settings. It's often a setting that's completely overlooked, I think, by a lot of academic and practitioners as well. I'm just curious, I know obviously AI is everywhere, but have you seen specific AI applications in kind of long-term care settings yet, or do you think it's still on the peripheries?
I definitely think that there are more and more AI technologies that are coming into the setting and being implemented. But a lot of the technologies that are out there, in most cases, are still at the bench and being assessed within research teams. And maybe those research teams interact with long-term care organizations and people in the community to test those devices, but they're not, in those research programs are often not as sustainable as they would be if they were offered on the market. And there are definitely things in the market that are influencing the uptake of technology, like sensor systems that monitor ambulation, and that monitors falls, and it monitors different changes in condition. We worked with some different sensor systems at a prior job that I had at the University of Missouri, where we developed with engineers sensors that helped us understand restlessness, and when people were laying in bed and maybe they were not comfortable, they weren't breathing as well as they normally do, and they get out of bed and they get up and sit up, and the sensor systems helped us detect things that were happening in the environment where people lived, and shared information with practitioners that then could intervene earlier. Whereas when you live without technology, you don't have that capability. So there are
Sure.
those kinds of things. I believe AI is becoming more and more integrated into the systems of care that utilize sort of uh, they use wearable types of technology or
Mm,
robotics types of technology where the robots are interacting with people, and maybe they can assess speech, and people with dementia, and look for changes in speech patterns. Those kinds of things are becoming more and more relevant and apparent in long-term care, but there's a ways to go, and
yeah,
it's quite varied in the implementation.
great. And do you have any advice for nurses who maybe want to do research in care homes, including maybe stuff on AI? Because I guess it's quite a different setting to work in.
It is. But it's such an important setting
Mm,
because most of our emerging models are really focused on keeping people at home in the community where they want and can live safely. So it's a big decision to make a change to move from the acute care setting and the ambulatory care setting where a lot of nurses are trained and they're very familiar with those processes and their training oftentimes doesn't include long-term care and or at least in the United States it doesn't. So we're really advocating for training nurses better across the continuum of care and giving them some access to training for informatics, and so that they understand um, all the aspects of different technologies that influence care delivery. You really can't work in nursing without interfacing with some forms of technology, regardless of where you work. And so there needs to be some effective training and competency development in those areas. And our training standards have addressed that with informatics in the United States through our uh, credentialing and nursing licensing as they're required to have some training in and competency in information systems. So I think as we get these innovative models, researchers really there's just a huge gap in long-term care that their research can fill, and it's a burgeoning area, and I believe that it's really important for them to consider that as they're going forward in their programs of research.
great. Yeah, thank you. Well, it'd be great to check in a year or two and see where things are at in the care home setting because the US is always a little bit ahead of the rest of the world in terms of its health information technology maturity, and
Mhm.
we're always catching up. But it's great to talk to you today and hear what you're doing. And thank you so much for your time.
Yeah, thank you so much, Siobhán.